Welcome to another seminar with Dr. Danijela Jakic called The Look from Another Window, where Dr. Danijela talks about fertility and Chinese medicine.
Good morning and welcome to another lecture at Right on Point. This time we're going to talk about fertility and Chinese medicine. And the subtitle says, The Look from Another Window. This is a little bit about me for the people that didn't know me before. Talks about my credentials and everything that I do in my practice. Why look through another window? One of the reasons definitely is because Chinese medicine has worked for millions of people for thousands of years. So it must be that it was doing something right, since, people survived by using means of healing which Chinese medicine prescribed. What are the strengths of Chinese medicine? Its holistic approach, definitely. And Chinese medicine looks at the human body and human as individual, as an indivisible part of nature. So all the laws which the nature is governed by can be applied or can be seen at different levels within our bodies and at the lower levels as well. Chinese medicine is looking at the physical, psychological, emotional, and spiritual aspect of our being and take all of that into consideration. Because just looking at the physical anatomy and physiology, we actually are not having complete picture. And we all know that our emotions and our spiritual practices, for example, meditation, can help us with certain issues, for example, to relieve the stress. What the limitations are? So healing, in my opinion, has no limits. Everyone is able to heal, but to what extent? Then it's not up to the person who is assisting the person to be healed. It's up to the person who wants to be healed to do and commit to the process and get him or herself to the state of optimal health by addressing different issues. For example, lifestyle. Lifestyle includes, diet, sleeping, emotions, profession, habits, everything, exercise, everything that can influence our health and our feeling of fulfillment in life. So what is on the way of healing is our beliefs. So that's something that I needed a little bit more time to understand. Even I was aware that some people, when they come for the consultation and I tell them, according to the assessment, what we have as a problem and how we can approach it and what they need to do in order to overcome that issue, they can't commit for some reason and they don't do things the way that you ask them to do because they either believe that it's not going to help or it's not really something that can make a big difference in their overall healing process. What Western medicine does focuses on anatomy, hormones, and assisted reproductive technologies. Now we're talking about fertility, so that's why we got this here. Common interventions are IVF, IUI, hormone therapy. What the strengths are: diagnostics, technology, evidence-based research, and limitations: stress, cost, sometimes unexplained infertility. So all these items we can talk, to huge extent if that was our goal today. But it's not. And people that are coming to these kinds of lectures, they already experienced a lot of different procedures, and they know enough about what Western medicine does. My background is in Western medicine as well, but in oncology. And I'm thankful that I have that background as well, because it helps me to understand what the people are going through when they're having IVF, hormone therapy, and all those other procedures that sometimes, follow the treatment. That, for people that have an issue with the fertility. So I'm here to serve as a bridge, in a way, between Western and Eastern medicine. And definitely there are advances in technology that Chinese medicine can't follow, but it's not meant to follow, because we're looking, as we said before, through another window. So Western medicine has its own window and looks at the human body as a complex machine, in a way, which consists of different parts. And then they know how those parts are influencing each other, and they look at different blood results, values, and according to that, they know exactly what's happening within the body. But despite of the ability to describe exactly what's happening at those very, very basic levels, at a cellular level and molecular levels, still, Western medicine is not able to help in all cases. The same applies to Chinese medicine, because Chinese medicine involves the person, which is in the midst of the healing process, but also there is something that we can't really control as a facilitators, for some people, even, whatever technique you're using. Because sometimes it's just, for some people, not appropriate to get healed at that point in time. Maybe because they're still going through the process that enables them to, through that experience, learn something that their soul, once upon a time, decided that it wants to experience in this existence. So I had a lot of issues trying to understand, because working in oncology, sometimes you come across people that are young. They don't have any family problems or financial issues. They're happy. They're eating healthy, exercising, doing everything right. But still, they're sick. And that was the point in time when I come across work of Dolores Cannon. And she was, because she passed away, maybe 5 years now. She was 73 when I was studying with her past life regression. And then, we were addressing those issues. And that's what I learned. That when we come to be incarnated in this life, that our soul actually has signed the contracts, what we want to learn, what we want to experience. And sometimes any disease actually is a lesson. It's a lesson for the person that is going through that, but it's also a lesson for the people which that person is surrounded by. So it's a lesson for the whole family. And that's something that they are going through and working out, and they are actually changing themselves. And sometimes, when I recognize that we have some kind of issue with this, with these obstacles, to complete healing, that's what I might recommend for the person to be done, apart, from the Chinese medicine. But that's, so we stepped a little bit aside from the Chinese medicine. So how do we start the journey? So the first step to fertility is not another drug or procedure, even an acupuncture treatment. It is discovering a new way of thinking about yourself, your body, and your health. So this is very, very deep. And that's something, how I practice. Because people are coming with different kinds of beliefs, different kinds of values, different kinds of practices, habits, everything. And but they don't get to the point to understand how actually what they're doing is affecting their health. What's happening? So I'm there to gently show them and offer some explanation. And then if they're open to it, they can change. Now they would know how. And quite often people come and they want immediate relief. They need instant, help. And it's not possible. You need to, whatever you want to achieve in your life, you have to pay some attention to it, you put some energy into it, and then you need to, be consistent and persistent. And then you can expect some results. So some patience is needed. And then this is Chinese saying that I really like. It says, we never wander so far as when we think we know the way. So a lot of people, went through different kinds of experiences on their fertility journey. And they were not like working for them, but they still would go and, repeat the same thing, thinking, it must work this way. It will work this way. It will work, And then sometimes people don't see the full picture. They're just concentrated on a small, small things, which actually are just part of the whole problem. When will I get pregnant? That's the, question that I always hear. And this is the only answer. This is the only answer. We can't really get person in and heal the person if the person doesn't want to be healed, if the person doesn't want to be, changed in a way. And it all takes time. So when we restore the health of the body and reproductive system, then we'll do what it was designed to do naturally, to conceive and carry to term a healthy child. Today I'm witnessing a lot of women going through IVF procedures. And that's what they were recommended through their doctors and gynecologists and then specialists. And they're exposed to getting harsh hormonal treatments, that are affecting them. They're feeling like they went into menopause, to start with, and then we got mood swings. We got different things, that people are experiencing. And then we're hoping that everything is going to be fine, everything is going to be worthwhile, once we get to the point that the embryo is transferred and then the embryo takes. But there is quite often, there is disappointment that, it doesn't happen that way. So, for example, why is this important for our body to be in the optimal health? We need to have a certain amount of energy when we get up in the morning. We have a certain amount of energy and then we use it for different kinds of activities. And then towards the end of the day, we get tired. Of course, we can't push ourselves to be continue working night shift then, because we just don't have enough energy. We can't do it. And with these procedures, quite often that's what we're doing to our body. We're asking the body to do something that the body is not ready to do. So by having the issue with certain thing, we need to pay attention to it. And we need to see why is that happening. Maybe there is not enough energy. Maybe I'm not sleeping enough. Maybe, I'm doing this wrong or that wrong or whatever. And we need to work on ourselves. But our lifestyle is very, very hectic. Everyone has, so many things that they have to do in their day. And we're just running, from one thing to another. We don't have time to sit down and think or to do things for ourselves. We need to have, time to sit down and have proper meal. We need to have cooked meals. We need to go to bed early. We need to get up early. We need to have exercise. And quite often, we don't do it because, we choose or we have to, for some reason, to do other things that we prioritize as more important. What should I do? That's another question that people, are asking. You should be an active participant and a decision maker in your life and be brave to face challenges, be committed to the process, be accountable. So, quite often, women are coming after 7, 8, 9 years of trying to get pregnant. And they're coming for the initial consultation. And when I ask about how they feel about taking herbal medicines that don't have the best taste, as it's known, they say, oh, I can't cook it. I can't have it. No, I can't. I can't do it. So I'm showing you the way, what you need to do in order to help yourself, and that I know that it will work. But if you're saying that you can't do it, that's you are withdrawing at the first obstacle. You don't want to, change anything in your behavior or habits. And so you can't expect to have a good result with that. You need to understand how your body works. So you need to learn how to adjust and change your habits that are not helping you to reach your goal. So once we uncover all the habits and everything that the person is experiencing and doing in their life, then the person needs to continue recognizing those situations and changing them all the time. So not just once. You need to really stay at your decision to change that habit. And then, it's not going to bother you anymore. It might be, coming back from time to time, but every time when you wait for it and address it the proper way, it's not going to bother you anymore. And it all takes commitment and energy and patience. Follow circadian rhythm. Eat healthy according to your body pattern. Manage stress, anxiety, and depression. So I'm going to explain about this circadian rhythm in a second. And I just want to mention that as a part of the program that I'm doing with my patients with fertility issues, that I always do seminar on eating healthy with Chinese medicine, and another one on stress, anxiety, and depression. Because going through fertility problems, it's very emotionally draining, and it's very stressful. It's very burdening as well. So we need to understand where is that stress coming from and how we can manage it, and what Chinese medicine says about it. Also, eating healthy. A lot of people come and say, I eat healthy. And when I ask, what do you do? How do you eat healthy? They say, I have a lot of raw fruit and vegetables and a lot of salads, and, it's very good. But then when we ask a lot more questions, we actually discover that their digestion has some issues. For example, with, having indigestion, bloating, having like a loose bowel motions and things like that. So one simple thing, like each food that we ingest affects our body. Each type of food that we have can be classified as a food which is cold or warm or hot. And even the way how we prepare the food affects that quality. So raw fruit and raw vegetables, they actually are classified as a cold food. When they are brought into the stomach, our digestion needs to work expend extra energy to warm everything up to the body temperature, and only then metabolism can start. So a person that already has like lower levels of energy, it will be extra expenditure that person can't really afford to have. And then the person will start having those digestive issues. So what is marketed these days, through different media and through different people that proposing different kinds of ideas about nutrition, we need to take all of that with a grain of salt. And we need to understand actually what is our body makeup. How the energy within our body is circulating. What do we need to do in order to rectify it, in order to help ourselves, to address those deficiencies that we have, and to address those excesses in different kinds of organs that we might have as well. So that's something, that I teach my patients and explain to them what organs are involved in the complete clinical picture that they are presenting with. So that's their pattern. And then according to that, they can choose, the food. Circadian rhythm. Circadian comes from Latin. Circa means around, and diem means day. So 24 hours around the clock. So this here. Western research has confirmed that our body is responding to certain changes in nature, responding to the cycle of light and darkness. And then certain chemicals start being produced in the morning, so we wake up. And then certain chemicals being produced later in the evening that are getting us ready for sleep, for rest and relaxation. For example, melatonin, which is the hormone, which starts working at 6 p.m. and starts, resting, helping us to rest and relax so we can go to sleep earlier. Chinese medicine went one step further and explained that the energy within 24-hour period is not going around the clock randomly, but it's going according to the schedule. And every 2 hours around the clock, the energy resides in one of the organ systems. And those organs which are affected at that time, they need to be performing their function at its best ability. So each organ follows the rhythm of nature. So we have, for example, from 3 to 5 in the morning, we have lung time. So we need to wake up early in the morning, from 3 to 5, ideally, because lung is the organ that can extract energy from the air for us, and it can help us, to start replenishing our energy reserves. So we need to get up in the morning, take our first fresh breath, outside, do some exercises and things like that. So it's not by chance that monks, martial artists, they're getting up early in the morning, they're doing their routines, chanting, praying, and whatever else they're doing. And they're taking advantage of this fact that the lung is the most active. From 5 to 7 is large intestine time. Large intestine is the organ responsible for elimination, so we need to eliminate all the waste that we accumulated from the previous day. And so energy is mostly concentrated within large intestine, and that's when we need to go to the toilet. From 7 to 9 is a stomach time. Stomach juices start to be active and waiting for us to present the stomach with some kind of nourishment. That stomach will start preparing for metabolism that is going to happen from 9 to 11 when there is a spleen time. Spleen time is not just a spleen like in Western medicine. So spleen is the organ, spleen encompasses functions of all digestive organs. Pancreas with its enzymes, liver with its enzymes, bile, bowel juices, stomach juices also, and some of the endocrine glands which are involved in the metabolism, for example, like a thyroid gland. So spleen is the one which is transforming all the food that we already put in at the time of our breakfast into the energy that we can use, and it's transporting it throughout the body so that all organs can have some energy and start working on it. Spleen also is the organ which is making the blood, according to Chinese medicine. And spleen is the one which is holding the blood within the blood vessels. Heart is active from 11 to 1, 11 a.m. to 1 p.m. So heart is not responsible just for circulation. So each organ of those 5 systems within the body actually houses one part of our soul. According to Chinese medicine, within the heart we have our Shen. Our Shen is our spirit. So if spirit is not cushioned nicely within, enough blood, so the heart needs to be supplied with enough blood, so the Shen doesn't get disturbed. If the Shen gets disturbed, then we have, for example, anxiety. So that's the first thing. Also, the patient or person might have some frequent vivid dreams at night, or some nightmares, or some insomnia. Small intestine from 1 to 3 p.m. is the organ that separates pure and impure. So pure is getting to be reabsorbed within the body and used, and impure is going to be directed towards the bladder and the kidney and filtered out as a urine, or it's going to be directed towards the large intestine. After that, we have bladder time from 3 to 5 and kidney from 5 to 7. A lot of people find themselves feeling tired during this time. Like a day energy curve just, start dropping around, that time. Because it depends, how much energy they produced during the day. And depends what kind of work did they do. And depends on the emotions as well. Because our emotions can lose a lot of our energy as well. I'm sure, all of us have some examples of that. Kidney is very important, for fertility. Kidney actually is housing all the energy within the body that consists of our ancestral energy and the energy that we have to replenish. So with everything that's happening within our body over 24 hours, there are certain points where we can replenish our energy. The first point is here with the lung, from the air, energy from the air. The other one is here, stomach and spleen, digestion, energy from the food and from the drinks. And then there is one more point, which is related to the organ that Chinese medicine calls sanjiao, which is the most active from 9 to 11 p.m. And that organ has a lot of functions, but one of them is functions as an energetic battery, and it gets energy from the universe for us when we are asleep. So it's most active from 9 to 11. So it's very good habit if we can get, to bed around that time. But a lot of people, especially like teenagers and younger people, they stay awake for a long time. So they miss that opportunity, and not that just that they miss it, but they are actively doing something, during that time of the night. And they are expanding extra energy from their body. So kidney is very important, that ancestral energy or jing that we have is the energy that we actually give to our offsprings. So we need to have enough energy into our energy box. So we need to produce enough energy in the morning, have breakfast, substantial breakfast, something that has life force in it, like eggs. Not oats, not Weetabix, those kinds of things that have nothing in it, no life force, but eggs. And then, we can count on the body, that body starts producing sufficient amount of energy. Energy is being used during the day for the work, all the organs, and for all the work that we're doing. So we shouldn't overwork as well, because it's taking extra energy from us. And we need to have, towards the end of the day, a little bit of energy that we're going to save within our energy box. And that is going to be there for tomorrow when we wake up. Because when we first open our eyes, we start consuming energy. So it's very important, to find a way to produce enough energy, to save enough energy, and then, to function within, our limits. Because only then the body will have enough for some extra activities. You probably heard or from your own example or someone else's around you, when you're working, you're healthy, everything's fine. But you go on holidays and then, I was sick my whole holiday. I don't know, I shouldn't get any holidays. I should just keep working. A lot of people, say that. quite often. The thing is, when you're on holidays, then your body recognizes there is some extra energy that I can use, for healing. And then the body brings those pathogens, we in Chinese medicine call it pathogens, from wherever in the body. Now we're going to deal with that. Something that was left, behind, left aside, and I'm going to deal with that now because I have some extra energy. And that's why people get sick. So it's very important, to have enough energy. Some people are coming in and they're saying, oh, I'm eating healthy and I'm doing intermittent fasting. So it's very good, for me. I said, what time do you do intermittent fasting? And they say, I don't feel like eating in the morning, so I usually don't bother. And then I try to extend it, to 3, 4 o'clock, and maybe I just eat, when I get home from work. So when I explain to them, what exactly is happening, then they realize that they actually spend whole day consuming energy, but not producing any. They're still alive, but where the energy is coming from? It's coming from, that energy box, from the ancestral energy. So they're depleting their reserves all the time. They're depleting the reserves, and they're shortening their life. That's what they're doing. I said intermittent fasting is fine, but you need to have breakfast, good lunch. You don't need to have dinner. You can have just a little bit of, fruit if you want or something, but you don't have to have dinner. Your body doesn't need it. Our insulin is a hormone which has daily shift. It finishes working at 6 p.m. A lot of people are having dinner, around that time or later. And so what's happening? Insulin should be relaxing. But we're constantly disturbing insulin and asking our, pancreas to produce more insulin at a time when it's not time for that, to be done. So we are expanding a lot more energy, doing all the digestive functions that we have to do because food is there, something needs to be done. And then, we're feeling tired, we're feeling fatigued, and we just look, where's the bed so I can, relax after, meal and things like that. But it shouldn't be the case. So till 6 o'clock is cut off, and even like 4 o'clock is a good time, to have the last meal and not to have anything after that. Then also, how much water do we drink? A lot of people doesn't drink enough water. They drink maybe 800 mils up to 1 liter. That's nowhere enough. What the consequences are? We have dry blood or thick blood, which is sluggishly moving through the vascular system, not able to nourish all the organs and all the cells properly. And then, as a consequence of that, because it's very sluggish movement, then we can have like a mild little small clots happening, especially in a little capillaries and things like that. And that quite often is the reason, for example, why women have issues with implantation, why the embryo cannot implant properly. Woman that wants to have a healthy pregnancy needs to have healthy blood. So a lot of women these days are coming to me and they are iron deficient as well. I mean, everyone is neglecting, the proper eating habits that should satisfy all the processes, within the body. So having good blood means having enough iron, having the proper ratio between the corpuscular part of the blood and the plasma, which is watery part. And then, So the blood can actually do all the functions that blood needs to do within the body. So nourishing and supplying oxygen and all those kinds of things. Also, to have good blood means that we can count on the body. The body has enough resources to nourish the ovaries. So we can, with nourishing ovaries, we can nourish all the follicles and everything. And with women that have issues, young women are coming with a problem of low AMH, anti-malarian hormone, which means that they don't have enough, ovarian reserves. But it's all because, those organs have been usually malnourished for a long period of time. So, that needs to be addressed, from different angles as well. From the dietary aspect, from the, blood aspect and the energy aspect and all that. So, that's something that Chinese medicine does all the time. So that's basically about, that circadian rhythm, what I wanted to say. Any questions about that? No? Okay. Now, so based on principles of Qi, or life energy, yin and yang balance, and 5 elements. So Chinese medicine sees the body as an interconnected whole, focused on restoring harmony, not just treating symptoms. So basically, if there is an issue within the body at whatever place, then we're looking at that not as a single issue, a single event. We're looking at, how everything else got to that point, that it manifested with that kind of symptom. And then I'm not going to talk in huge extent on Qi or life energy or yin and yang balance, and I'm going to talk a little bit about the 5 elements, because that's important. Because when we do, during the initial consultation, all the questionnaire and everything, when we talk about everything, then I usually have, that 5 elements in front of me, and then I go through that, explain to the person exactly what's happening within the body. So where is the weakness or deficiency? Where is the excess? Why they've got different kinds of symptoms? So we go through all the symptoms and we explain exactly why that symptoms is present, within the body at that point in time. You say that ancients grouped all the body organs just within those 5 elements that correspond, to the nature as well. So, and there are different colors. For example, wood element is green, and it corresponds to spring as well. Fire is red, corresponds, to summer. Earth is yellow, like earth is nourishment, digestion. And it corresponds to late summer, which is last 18 days of summer. And then metal. Metal is white and corresponds to autumn. And kidney and bladder, they belong to the water element. And they correspond to winter. So all these elements, they have, and all these organs, they have their yin. All these elements have their yin and yang aspect. For example, kidney in water element, kidney is yin aspect, and yang aspect is urinary bladder, and so on. If we start, for example, what we're dealing with on daily basis is stress. So whatever we perceive as a stressful situation, for some person it might be stressful, but for another person it might not be stressful. So it's just what that person is recognizing as a stressful. And then it has effect on that particular person. So our liver and gallbladder, they belong to the wood element. Liver actually is housing another part of our soul, which is called Hun, emotional soul. So by stress, our emotions are affected first. What's happening then? Normally, wood energy would go up and reach and, unfold. The same like when the wood is growing and rising. But if the stress is coming our way, the wood with its emotional soul is the first organ to react. And then it reacts by freezing its energy. Its energy is not moving, because it wants to protect all the other organs within the body. And it hopes, that you'll be able to do it. So that's fine if the stress is not taking place over a longer period of time. But then if it does, what happens? That excess kind of condition, which we called liver energy stagnation, liver energy is not moving properly, is going to affect, other systems along these lines in the circle and around the circle. So, firstly, I'll explain this outer circle, which we called Sheng or generating or creative cycle. So wood is creating fire, fire is creating earth or ashes. Within the earth we can find metal, metal is dissolved in water, water is nourishing the wood. So that's how they are generating each other. So it's so-called mother-son cycle. Then these lines inside, they're so-called controlling cycles. So wood is controlling the earth, earth is controlling the water. We know that because, if we have flood developing, then we're going to put, some earth in those bags or some sand, and we're going to try to, keep water under control. Water is controlling the fire. That's self-explanatory. Fire is melting the metal. Metal is cutting the wood, and wood again is controlling the earth. So wood is controlling the earth. You can imagine, for example, if you have one piece of land, and then you're going to use it for gardening, or, or you're going to put some orchard there or whatever. So if you put those little seedlings very close to each other, they're going to exhaust the nourishment from that earth. They won't be able to develop properly, yeah? So that's how, the wood, which is, that live wood, which is sown into this, seeded into that piece of land, is exhausting the earth. So if we have constant stress affecting the wood element, and we have that constraint, liver energy constraint, then it's going to affect the earth, and then we have problems. For example, if the stomach is the most affected, the person might have acid reflux, vomiting, nausea, because stomach energy needs to go down properly. If it can't go down, it will have to go somewhere. It will go up. For spleen, if spleen is under such a pressure for a longer period of time, spleen can't work properly, and then spleen starts showing signs of getting looser bowel motions, diarrhea, bloating, like a pain inside of the stomach, different kinds of things. And it starts retaining some dampness or fluid inside of the body, inside of the cells, around the cells. And then we have different kinds of issue forming. So if we don't have enough water element, then obviously that water element can't control the fire element. Even the fire might be, within normal limits. If that energy is very low, then we'll have some symptoms that will have like heat symptoms within itself, yeah, heat or fire, and we call it heat, but it's empty heat. It's heat because it's being produced as a consequence of deficiency of this element water. So in order for that to be rectified, of course, we need to nourish that element. And so on. So with any kind of presentation, people usually have imbalance within the three of the elements. Quite often with fertility, we have imbalances that include wood, earth, and water. Usually not those other two. So with some other, whatever the issue you're looking at, then you may say, involvement of some other organs. But then what's important is you need to concentrate on the most prevalent kinds of symptoms. And of course, the other symptoms are very important, but they're like a secondary. They will go away, when those first primary ones are dealt with. So as you can see, our body has to function in harmony. And that's what we're going to, we need to address. So I've got the chart for you to take home. If you're interested, to find out more about 5 elements and what they are related to and what they're governing, okay? And then a lot of, things would be much easier to understand. So we're not going into this, in details. So we already mentioned that Chinese medicine says fertility linked to kidney jing or essence or our foundational energy. And liver, spleen, and heart also play key roles in hormonal regulation and emotional well-being. And we don't separate mind from body, stress, emotions, and lifestyle. It all matters. So these are some patterns related to infertility, some common diagnosis. So we need to, as I said, we need to find out which organs are affected and if there is an excess or what kind of, problem we are facing at that point. Or if there is a, excess or if there is a deficiency. So it can be a combination of these. It's not usually like you can have liver qi stagnation and you'll have kidney yin or yang deficiency and blood stasis, so, those kinds of things. So you'll have a combination of all these diagnoses and all these issues. And then, there is a way, how it can be addressed and how it can be rectified. So each pattern suggests unique treatment approach. So, for example, you may have 2 people coming for the same thing, but when you do diagnostic process, you will find out that actually the problem for this person are stemming from this imbalance. They've got this pattern, and the problems for this person are stemming from this imbalance. They've got that pattern. So you're going to treat it differently. Whilst in Western medicine, the person will get diagnosis, and everyone is going to be treated the same, which, in Chinese medicine gives us more options to tailor exactly the treatment according to, what patient is presenting with, and to address those issues. Because with like a simple acid reflux, we have like 39 patterns that acid reflux can fit in. So you need to find out exactly what the patient is presenting with. You have to take into consideration everything from the moment, they were conceived. So quite often, we have to ask questions from the moment, what number child are they? And did the mom have any issues during the pregnancy? Have they had any birth trauma or things like that? So this is the graph, which is very useful, to understand and to know about. So, for example, on this line here, we've got, you see, age. That's age. So this is the point 0 when we're born, this one here. Yeah? So at that point, we have potential to live 120 plus years, because that's what our genetics is programmed to do. And with everything that we do to ourselves, during our life, we make sure that we don't actually reach that full extent of life. On this line here, you see these percentages. So this should be 100% here. And it says function. But function is related to natural healing ability of the body. So how, we need to have that natural healing ability preserved to a certain extent if we want to function without, symptoms, without problems, and things like that. So if the person didn't have any birth trauma and, pregnancy was no problems, normal vaginal delivery, everything, and the person was, as a baby thriving and developing as a child, no problems, then it will be 100% here. But if someone had birth trauma, it probably will drop, to 90 or 80%. And everything else that we encounter through life that is going to affect our natural healing ability. So you'll see what is written there. Like the child, 2 to 5 years old, has around 2,000 falls. It's all treated as a stress to the body. So basically, different stresses at different part of our life. Teenagers have, certain set of problems, and then, studying, maybe trying, alcohol, staying awake overnight, different kinds of things. And then, we have issues that young adults are facing, looking for jobs and establishing themselves, buying the houses, getting married, and all those kinds of things. So everything is fine, usually, till the age of 40, when, something happens and we have that event that broke the camel's back. Basically, we had enough energy that we were using all this time without actually paying a lot of attention to replenish our normal reserves and thinking we are invincible and we're going to live forever. And then something happens and suddenly, they develop symptoms that are not going away. So what happens and when that happens? It happens when the person drops below 30% of their natural, energy levels and the healing ability. Then the person will have symptoms. And then the person will go to the local doctor and get some medications, get better. And then if stops taking medications, it will get back down there. So the person will need, some symptomatic relief. And that's what person will be getting. But those kinds of medications are not able actually to bring the person above 30%. Because they're not addressing the body at that level that is replenishing the energy sufficiently. And the person is just fluctuating within, that lower level all the time. So with approach that Chinese medicine and acupuncture have. We have ability to bring the body above these 30% with the frequent acupuncture and the herbal medicines together. And then we go through these stages. One is called relief care, when all the symptoms, whatever the patient is experiencing, are dealt with. And then we can start that corrective care, where the person goes, up. So all the organs start improving and achieving their optimal state of functioning. So each one of us has, their own individual level to which their organs can improve. For example, for someone who is 85 years old, their optimal level of functioning would be, that they're able to look after themselves, not to go to a nursing home and things like that. But, for someone who is 40 years old or younger, those people, need to have enough energy that they can go to work, not to feel too tired, and do other activities that they enjoy, and go out with their children and all those kinds of things. So we need to have enough energy. It's not normal, that we don't have energy. And a lot of people is just accepting that kind of being. And after that, we have just maintenance. So, which means when the body reaches a certain level, then the body can't improve anymore. And of course, at that point, we don't need to continue pushing the body to improve more. We need to just give body a chance, to function at that level. And then if some situation arises, for example, if the person is getting cold or flu, then the person can come and have, some top-up. I have some medications, herbal medications given, so they overcome, those symptoms much quicker. So that's something, that we need to understand, and we need to keep in mind. So that's why, this kind of care that, Chinese medicine is providing is not something that can be done overnight. And it's not something that, can be achieved with just weekly visits and having weekly acupuncture. A lot of people has misunderstanding about, how acupuncture works. So with acupuncture, we have a chance to get the person into the state of the relaxation when the body is functioning in parasympathetic mode, and that's the only neurological mode that the body can use to heal itself. But if the body is very deficient, if there is problems with the blood as well, and other issues, they need to be addressed simultaneously, and they need to be addressed over a certain period of time, and we need to follow up the person closely, so we see exactly how much that person is improving, what has improved, and we need to tailor our herbal medicines in order to support the healing process completely. So at the end of this, I put actually for your reference to some of the papers that actually say different things. For example, there is a study that Melbourne University has done researching, the effects of acupuncture on fertility and things like that. And they've come to the conclusion that, it doesn't help at all. And the same as there was a BUPA funded research that says, it's a myth that acupuncture, can change anything with like a changing prospects to the viable pregnancy. I agree with that. I agree with that because, people are coming only once a week, and whatever you ask body to do 1 week ago, the body forgot already. Body is too weak. Body can't sustain those changes and support them that we already instigated within the body. So that's why we need more frequent acupuncture. And that's how we can achieve those results. And herbal medicines all the way through, and close observation, what's happening. So, and the other, in comparison to those two studies, I mean, there is so many studies that you can look at online, and everyone, I'm sure, does it if they're interested to find out more about issue that they're really concerned about. The other study that has been done by it's a journal for alternative medicine. It was done in 2011. And they were doing a meta-analysis of a number of different studies. And you'll have details over there anyway. So basically what they found is that having acupuncture and Chinese medicine over 3 to 6 months before you get pregnant increases your chances of pregnancy by like a 66%. So that's what I'm advocating for, and I'm saying that, we need to understand how body can improve and what body can do, and we need to support the body on that path. So, as I said, nothing can be done, in once like a weekly visits. And if people, people don't understand, and people come and people ask me, and they say, they would like to come once a week. I said, don't waste your money, don't waste your time, because you're not going to have results that you're expecting. So, but there is a way. So, tools of the trade. So, what are we doing? Acupuncture, as we already said, herbal medicine, diet therapy, lifestyle, emotional health, stress reduction, sleep, emotional processing, medical qigong, and yin tuina. So, we may employ any of those or some of them together. Chinese medicine complements Western fertility treatment, and acupuncture is often used alongside IVF. I mean, we have a protocol that quite often I have a phone call from women asking to come and have pre-embryo transfer and post-embryo transfer acupuncture. And that's what we provide, because that's what, according to some research, has shown that there are some differences, for the overall, result of the pregnancy. But we'll see. Definitely, for those moms, the stress levels are very high, and acupuncture in that respect help, for that to be controlled. Case study. So the way I practice, especially with the, fertility issues, first thing that we have to have a look is we have to regulate menstrual cycle. Because if menstrual cycle is not regulated, then everything else is affected. So we need to establish reestablish that hormonal balance. And the menstrual cycle needs to be followed for at least, 3 cycles. So we see exactly what kind of changes we achieved and how the person is responding, how much the person improved. So what I'm advocating for also is to change that perception that fertility issues are occurring and starting once the woman wants to get pregnant. Those issues have much deeper roots. They're starting when the girl gets her first period. Because a lot of girls these days have irregular periods, they have heavy bleeding. I had a girl 13 years old recently that came with her mom, and so I was looking after her for 3 months, and we regulated her menstrual cycle. So she was exhausted, 13 years old, exhausted, with the heavy periods, losing blood, all those kinds of things. We in Chinese medicine can say how, a certain pattern is developing and how it can, from one presentation, change to another presentation and affect different organs. So from that perspective, I'm saying that whatever irregularities you can see in your daughter or yourself, that they need to be looked at. And a lot of women is dealing with the menstrual pain. No woman should have menstrual pain. It's not normal. And that's what Chinese medicine, can help with a lot. So if some of the girls go to local doctor and they're prescribed a contraceptive pill, which put the young body into the state of mimicking like they're pregnant. So the situation is not rectified. It's just masked with the hormonal influence. And then once they're off the pill and they want to get pregnant, then they start having issues because all that is still there. I helped a number of people with female and male infertility, different reasons. Some people had so-called genetic kind of issues. For example, with the first child, when they got here, and they wanted to avoid that with the second child. So I didn't help them in that respect. But, I made sure that their body is at the state of the optimal health. But they of course, used all advantages that Western medicine can offer and, checked the embryo and everything. And so, for example, they got viable pregnancy and healthy baby and all that. And, women usually say, I'm old and, it won't happen to me. But, it doesn't matter from Chinese medicine perspective how old are you. You just need to get yourself to the state of the optimal health. And then your body will be able to do things, maybe with some, form of assisted reproductive technique, but maybe not. And so I helped also with male infertility when the young man that came to me could couldn't father the child because his results were really, really low and motility and morphology was really out of order. And then I looked after him and his wife for 4 months. The wife was coming to support the husband, but she also wanted to get herself to the state of the optimal health. And so 2 months into treatment, he they were actually looking for IVF doctors and what they can do and things like that. So he had repeated his sperm tests, and the tests showed that his motility and morphology were within normal range then. And then also his overall number of sperm doubled. It was still low, and he was devastated because he said, oh, there is not enough of them. I said, don't worry, we just need one healthy one. So basically, there was a lot of anxiety that we had to deal with. There was a lot of other things that we had to address as well, but they were really committed and they were really loving to each other, which is very important in those cases. And so when we finished, they asked, what are we going to do now? I said, nothing. I said, now you go on holidays. So they went on holidays and they conceived. And in 2023, they got their son. And I think that the lady, she might have actually given the birth, to the second child, all natural. So, there is, your body can change. Body can change, body can heal. We just need to provide the proper conditions. We need to provide the proper support. And sometimes a less intervention is more benefit. Then also, I looked after ladies in their 40s that were told that they don't have enough ovarian reserves. They are, according to their hormonal status, they're already in premenopause and things like that. But it didn't stop them from, getting pregnant as well. Challenges and considerations. Yeah, results may take time. And patience is part of the process. And not all conditions can be addressed by TCM alone. As I mentioned before, importance of qualified practitioners and safety in herbal use. Of course, we are governed by the APRA, the same as medical practitioners, nurses, physiotherapists, and chiropractors. So we have to register all the time on a yearly basis and do our, studies and all those kinds of things. And also TGA is governing herbal, whatever, herbs and preparations we're using. So, and I always try to get the best quality organic herbs if I can for my patients. And with those kinds of commitments, then you get results. So Chinese medicine invites us to see fertility as a reflection of whole body health. It offers not just hope, but harmony. Integration of tradition and science may offer the most complete care. Now, if you would like to comment, would you answer some of these? What were you surprised by? Anything? You can answer as well.
No, it's true. If everything's healthy, then everything should work.
Yeah.
Surprised by the common sense.
Yeah.
Yeah.
It takes only common sense to make things at least start working.
Yeah, but you need to keep working on it.
Well, you need a guidance from somebody who actually
Exactly.
knows how to deal with
Exactly.
whatever it is, the issue you're having. So
yeah, that's why I'm here, and I'm devoted and I'm connected to my patients all the time, and if they experience any kind of symptoms that they didn't have when we start some treatment or whatever, they need to let me know straight away, because then I know exactly what's happening, why is that happening, and I can adjust it or I can do, whatever needs to be done. Because my main role is to follow closely the healing process. During the healing process, the body changes. And I can't give someone medications for one month and they go and take it. It doesn't work that way. We need to see exactly what pattern the body is in now, what pattern the body is going to be, in a couple of days, tomorrow, because it can change very, very quickly. And then we need to, meet it, and then we need to address it. Yeah. And what's also wrong, in my opinion, when they're testing, they're doing like acupuncture and sham. They call it sham acupuncture. I mean, in both situations, you are affecting the body's chi or electrical, currents. You're affecting it. So it doesn't matter, it will have some kind of effect. And then they say, it's not conclusive. What I'm saying, like the research methods that Western medicine applies and goes by cannot be applied to the same extent to Chinese medicine, because we work completely differently. I can't, for example, if they are testing in Western medicine 2 medications for certain kind of condition, so all the people will have the same kind of condition and have the same. These will have this medication, these will not have that medication, for example. In Chinese medicine, we can't work that way. These 10 people will have all different patterns. I have to give them different things, because if I want to help them. So you can't really judge on the basis, like we're going to give them these herbs and see if these herbs are working for that. No, it doesn't work that way. But anyway, so I hope that we'll find, the way to validate, in a way, what Chinese medicine does, but we need to provide the proper conditions for that. We can't, put everything in the same basket and then, expect that to be relevant, to Western and to Chinese medicine. Yeah. So that's the link, and this is basically the summary of what it says. So, basically it says if you have like a longer treatments, proper treatment, then you'll have result. That's what it is. So that's all that I had to share with you today. Thank you for your patience, and I hope you will go from here with some new knowledge, new understanding that will help you.